More than 1 out of 10 people over the age of 60 suffer from chronic knee pain from osteoarthritis. Osteoarthritis, or OA, is a condition that results in chronic inflammation of the knee joint with erosion of the cartilage within the joint over time. This means that for most people, the symptoms get progressively worse as they age. Currently, there are a variety of options available to treat chronic knee pain from OA. The treatment tends to be based on the severity of the patient's symptoms. Mild symptoms can be addressed with lifestyle modification, such as weight loss and exercise. As symptoms become more severe, patients are often treated with medical therapy. This approach generally starts with over-the-counter, non-steroidal anti-inflammatory agents and progresses to prescription-strength pain medications. When the knee pain no longer responds to medication, the next step is joint injections with either steroids or a cushioning substance. Finally, when symptoms are severe and no longer respond to any of these therapies, several surgical options exist, with the most frequent being joint replacement surgery. While joint replacement is extremely effective in eliminating pain and restoring function, it does have associated risks, including infection and failure of the device over time. Thus, it's generally best to try to put off joint replacement surgery for as long as possible. There's a new alternative treatment that may fill the gap between conservative therapy and joint replacement surgery: geniculate artery embolization. Geniculate artery embolization, or GAE, is a well-established procedure for treating patients with bleeding into the knee joint. More recently, it's been found to also be effective in managing patients with chronic knee pain from OA. GAE is a procedure performed by an interventional radiologist. It is performed through a tiny incision in the groin through which a small catheter is placed. This catheter can be guided using X-rays into the arteries around the knee joint. These arteries are then blocked by injecting tiny beads. The catheter is then repositioned to treat any other arteries that may be contributing. Blocking these abnormal vessels with tiny beads causes death of the surrounding nerves due to lack of blood and oxygen. However, because only the abnormal blood vessels are targeted, the remainder of the joint, including the bone and cartilage, is unaffected. So does geniculate artery embolization work? Currently, this procedure is in the early stages of investigation, but results so far are promising. In a study from Japan, 72 patients were treated with GAE. 80% of these patients had at least a 50% reduction at 3 years after the procedure. More recently, a U.S. study was performed that confirmed the majority of patients undergoing GAE had sustained pain relief 6 months after the procedure. Currently, more work is being done to evaluate this treatment option, but it's clear GAE is an exciting, innovative procedure that holds tremendous promise for patients suffering from chronic knee pain from OA.